Welcome to Medicare Accountable Care Organization Integrity and Compliance Training. In this lesson, you will learn how to describe a Medicare Accountable Care Organization, or a Medicare ACO, and explain what it does. You will learn about certain compliance requirements of Medicare ACOs that go beyond those generally required of healthcare providers. You will learn about your Medicare ACO's integrity and compliance program and your responsibilities in supporting the program. Finally, you will learn how to locate resources available to report compliance issues and concerns involving your Medicare ACO. Click Next to continue. As we begin this lesson, it is important to level set and explain what a Medicare ACO is and what it does. A Medicare ACO is made up of groups of doctors and other healthcare providers who voluntarily work together to coordinate care for Medicare beneficiaries. Medicare ACOs share in savings that result from providing Medicare beneficiaries with coordinated high-quality care. Medicare ACOs are not managed care organizations, and they do not limit a beneficiary from choosing his or her provider. The Centers for Medicare and Medicaid Services, or CMS, has established specific compliance requirements that Medicare ACOs must follow. You'll learn about these requirements later in this lesson. Compliance training is important. CMS requires all Medicare ACOs provide compliance training to their employees and to participating providers and suppliers. Your organization has chosen to participate in a Medicare ACO. This training will help ensure you understand Medicare ACO requirements. Non-compliance with CMS requirements is very serious and can result in termination from participation in the Medicare ACO program. Medicare ACOs have additional requirements beyond those which you may have learned about in compliance training provided by your organization and that you'll learn about in this lesson. CMS has established compliance requirements for Medicare ACOs that address areas such as medically necessary and appropriate care, high-risk beneficiaries, beneficiary choice, communications with beneficiaries, and providing beneficiary health incentives, among other things. We're going to go through each of these requirements one at a time, starting with medically necessary and appropriate care. Click Next to continue. Your Medicare ACO is committed to achieving the goals of better health, better care, and lower costs. This goal is achieved by providing high-quality, cost-effective health care to Medicare beneficiaries that is both medically necessary and appropriate. Medicare ACOs may not deny, reduce, or limit medically necessary services or treatment, engage in any practice or activity that would reasonably be expected to deny or discourage providing medically necessary services to Medicare patients. CMS has stated it will monitor claims data to ensure ACOs comply with these requirements. Medicare ACOs are prohibited from avoiding higher cost or at-risk Medicare beneficiaries assigned to it in order to keep costs low. An at-risk beneficiary includes a patient who has a high CMS risk score, has one or more chronic medical conditions, is dually eligible for both Medicare and Medicaid, is diagnosed with a mental health or substance abuse disorder, has had a recent diagnosis that is expected to result in increased cost, has had 2 or more hospitalizations or emergency room visits each year, or otherwise has a high healthcare utilization pattern. These patients, however, may appropriately be identified by the ACO in order to better coordinate and deliver their care more efficiently and improve their health. Can a Medicare ACO limit Medicare beneficiaries to seeing only your Medicare ACO providers and suppliers? The answer is no. Medicare beneficiaries are free to seek care from providers and suppliers outside of the Medicare ACO. Your Medicare ACO is not a managed plan, nor is it a closed network plan. Participants in a Medicare ACO may not engage in or adopt policies that restrict or limit the right of Medicare fee-for-service beneficiaries to obtain healthcare services from providers and suppliers they choose. However, your Medicare ACO can actively encourage Medicare beneficiaries to choose an ACO network provider or supplier and communicate the benefits of receiving well-coordinated, high-quality care from ACO network providers and suppliers. You need to be mindful that CMS has placed strict requirements on communications with Medicare beneficiaries regarding the Medicare ACO. Click the button to see examples of types of communications affected. Medicare ACOs may not use incorrect or misleading information in communications or marketing activities such as beneficiary notices, brochures, websites, advertisements, outreach events, mailings, and social media. All communication materials provided to Medicare beneficiaries must include Medicare and Medicare ACO contact information. Additionally, certain Medicare ACO communications and all marketing and descriptive ACO materials require the advance approval by CMS before they can be used. Medicare ACOs must keep in mind several other CMS requirements when preparing communications involving descriptive materials for use with Medicare beneficiaries. If your role or responsibilities involve communications or marketing activities with Medicare beneficiaries, please refer to your Medicare ACO's policies for more information on these requirements. CMS does not require review and approval of certain types of Medicare ACO communications with Medicare beneficiaries. For example, materials that do not directly or indirectly reference the Medicare ACO or that are not considered marketing activities do not require CMS review and approval. Click the button to review other examples of Medicare beneficiary communications that do not require CMS review and approval. Unlike fee-for-service Medicare, CMS allows Medicare ACOs to provide limited free or discounted items and services to Medicare beneficiaries as incentives to promote their health and wellness subject to specific requirements. Beneficiary incentives must be in-kind in nature, meaning they must be in the forms of goods, commodities, or services. Second, any incentives provided must be reasonably connected to the medical care of the beneficiary. Finally, incentives must be for preventive care items or services or intended to advance a specific clinical goal, such as adherence to a treatment regime, a follow-up care plan, or the management of a chronic disease or condition. An example of an appropriate beneficiary incentive would be providing a blood pressure monitor to a patient with hypertension to encourage regular blood pressure monitoring. Cash or cash equivalents, such as gift cards redeemable for cash, are financial in nature, not in-kind items and services, and can never be used. Similarly, gifts unrelated to healthcare, such as theater tickets or restaurant gift cards, would also not qualify. Programs that provide limited in-kind items or services to Medicare beneficiaries must be approved by your ACO. Check your ACO's policies before providing any such incentives to Medicare patients. Medicare ACOs are prohibited from routinely waiving beneficiary copayments and deductibles. The routine waiver of copays and deductibles would be a financial, not in-kind incentive and is prohibited. Any such waivers must be based only on a determination of beneficiary's financial need. Medicare ACOs are prohibited from giving Medicare beneficiaries rewards for receiving services from the ACO. Medicare ACOs may not give gifts that are intended to persuade a beneficiary to remain in the ACO or with a particular ACO provider. Please note that if your organization is participating in a next-generation model ACO, CMS will administer any coordinated care reward for eligible beneficiaries. Beneficiaries with questions regarding the coordinated care reward should be directed to contact Medicare at 1-800-MEDICARE for more information. In addition to the areas we've covered, Medicare ACOs must also develop processes that support evidence-based medicine, quality assurance, and patient engagement. You may be asked to periodically assist in the gathering, recording, and submitting of data and other information to CMS. Your assistance and cooperation in ensuring such information is timely, accurate, and complete is appreciated. Medicare ACOs are required to keep all records related to the ACO for a minimum of 10 years after the ACO agreement period ends. If you have any questions, please refer to your ACO's records retention policy for further information. Medicare ACOs are required by federal and state laws to maintain the privacy and security of all protected health information, also known as PHI, received from patients. PHI is individually identifiable health information. Any individually identifiable information counts as protected health information if it relates to an individual's past, present, or future physical or mental health, their medical history, or their payment for health services. You are expected to handle PHI in an ethical and responsible manner and to take reasonable measures to protect the confidentiality and security of PHI. PHI must be treated as confidential in all forms, whether on paper, in electronic media, or in verbal discussions. Further, you are expected to access and use the minimum amount of PHI necessary to do your job. You may also be subject to additional requirements of CMS Data Use Agreements, DUA, if your role and responsibilities in the ACO involve working with Medicare claims data. These requirements specifically relate to access and use of Medicare beneficiary claims data and other information. Refer to your ACO's policies for further information. Medicare beneficiaries have the right to elect not to have their CMS share their personal health information with the ACO and to make changes to any prior data sharing election at any time. If requested, the ACO must provide Medicare beneficiaries information on their rights to opt out or to modify their data sharing preferences. Please refer to your ACO's policy on beneficiary notifications for further information. Your Medicare ACO is committed to honest and lawful conduct. This includes following all laws, regulations, and requirements of participation in the Medicare ACO program. All ACO participants and suppliers are expected to act with honesty and integrity in their activities involving the ACO. For example, federal and state laws prohibit the payment or exchange of anything of value to induce or reward patient referrals that are paid by a federal or state healthcare program. As a participant in a Medicare ACO, you may not offer, solicit, pay, or receive anything of value directly or indirectly for referring Medicare beneficiaries for services. This also extends to receiving anything of value for furnishing or arranging for goods or services for a Medicare beneficiary. Your Medicare ACO's Board of Directors has established an integrity and compliance program reflecting our commitment to act with integrity, to make decisions based on the highest standards of ethical and professional behavior, and to follow all laws, regulations, and ACO participation requirements. How does this program help you? Your Medicare ACO's Integrity and Compliance Program provides resources and tools to assist in supporting this commitment. Click on each item to learn more about these resources. Click Next to learn more about resources to assist in answering questions and reporting issues and concerns. You are encouraged to seek answers to questions and to report issues and concerns involving your Medicare ACO. You are expected to report in good faith any actual or suspected fraud, waste, and abuse, or violations of law or regulations of your Medicare ACO's policies. You may contact a member of your Medicare ACO's management team or your Medicare ACO's Integrity and Compliance Officer. You may also call your Medicare ACO's Integrity and Compliance Hotline at 844-234-7746. This hotline is available to you 24 hours a day, 7 days a week, and 365 days per year. When you call the hotline, you will speak with an individual trained to listen to your concerns and to gather as much information from you as possible. When calling the hotline, you may choose to remain anonymous if you wish. Please note that calls are not traced or recorded, and the Integrity and Compliance line does not use caller ID. Your ACO will maintain, within limits of the law, the confidentiality and identity of individuals reporting issues and concerns. Please note that your Medicare ACO prohibits any form of retaliation against individuals who report issues and concerns in good faith. Let's review what you have learned. Read the following scenarios and choose the best answer. You have completed this lesson. You can now describe a Medicare Accountable Care Organization and what it does. Explain certain compliance requirements of Medicare ACOs that go beyond those generally required of healthcare providers. Describe your ACO's integrity and compliance program. And locate the resources available to you to report issues and concerns involving your Medicare ACO. You may now exit this lesson.